We're lucky here. We're well placed with the big children's hospital here, the big adult hospital here, the research institutes linked to the university, and the big reference laboratories that are based all here. So it makes it relatively easy to assemble a team who can manage pretty much everything. And so we were among the first, certainly in Australia, to experiment with the use of phages as therapeutic tools, but it was just easy in this context to develop this into a fully fledged program. So I think that's one of the unique advantages we have here, I think. And the other wonderful thing, of course, is to be able to network with all our like-minded colleagues all around the country and indeed around the world. But certainly there are like-minded colleagues in Victoria and South Australia, Western Australia and Queensland, and we're all keen to work in a big national network to drive this forward, because it's clear that we need to have a cooperative and collaborative approach to this if we want to really achieve a public good, which is our main mission here. So I think it's important to state that this is really a European initiative since, about the First World War, really. And as I think I said in a previous conversation, it really had its heyday in the 20s and 30s. And still there are institutes in the old Eastern Bloc that, particularly in Poland and Georgia, and certainly in France, where there was leadership from the outset, that are still providing phage therapy now. So we're newcomers to this, but a lot of people like us in the US, in Denmark, in Korea, in Australia, and all throughout Europe have embraced this as a potential new solution to antimicrobial resistance, and because it has great promise, even irrespective of the failure of antibiotics or the risk of failure of antibiotics. So globally, we see a lot of people who are developing high quality banks, collections of therapeutic phages, and of course we are, through our colleagues like Phage Directory in the US, who are trying to coordinate this process in I was going to use the word, international public good. It really is. There's a lot of researchers who are donating freely of their time and expertise to make therapeutic phages available for clinicians like myself to use. And so at the moment, what we are trying to do is network as effectively as possible to bring in these big collections of bacteriophages and make them available in an organised fashion so that it's not too chaotic. And that means a lot of collaborative agreements about how they're used, how they're defined, and how to keep the data so that it's shared and we all learn together. I think Margaret Chan in 2014, as Director General of WHO, made the statement that the antimicrobial resistance crisis potentially portends an end to modern medicine as we know it, because we are so dependent on the ability to combat bacterial infection to manage our modern health systems, and because the exposure of bacteria to antibiotics globally has meant they've adapted, as they do, of course. And so the harnessing of phages as a therapeutic allows us to use something that nature has refined for really many millions of years, since long before we evolved. And if we can learn from that enough to manage it, then we can precisely control bacterial infection, including in a human, when things get out of balance. Because by definition, humans need bacteria in an ecosystem like a rainforest. But occasionally things get completely out of hand and one invasive problem takes over. And so nature's response to that is what we need to learn to harness, and that's what we're all trying to do.